So good afternoon, or good afternoon, everybody. I think we have to start now. We have just a small time slot here, and I'm very happy that you are fighting for chairs. That means that you're all interested in being here. Please relax, take your lunch packet, and enjoy something really new. Something that we actually, I cannot remember ever having a symposium on slit lamps at the ESCRS since it was founded, frankly speaking. And we're talking here about an instrument everybody takes for granted because you have it there, you have learned on it, and you never made any thoughts about, can this get any better or something? And I think we are here now all together to show you that there can be some change and there can be some advancement or enhancement in a slit lamp, and you can put a slit lamp in the 21st century. And we have an excellent faculty that really has a lot of experience now gathered in the last couple of months about that. And we will talk about our experiences here and let it share with you. You can ask questions, you can send it to me. I have a laptop, iPad there where I see some of the questions. Due to the time constraints, we may just go into some of the questions depending if they are on general interest. And we may do that at the end of the presentations. So without further ado, I would like to start now. And these are my disclosures. When we look at the Haag-Streit slit lamp, I think what sticks out is the legendary Swiss-made optics. And everybody, I think we are all used to an optimal optical view when we use a Haag-Streit slit lamp. And we expect, of course, the same from the new digital version. And the Elara 9000 delivers really superior clarity and contrast. And also the illumination capabilities are very innovative, and we will see that we can use also the different various wavelengths and everything from the light projecting in order to actually use the take much more usage out of this. The Elara 900 also let you customize your workflow. You can have automated presets that guide you through, for example, evaluation for corneal procedure, for if you have a DMAC and you do a follow-up, or if you want to do a cataract surgery or post-cataract surgery, that you have the right magnification, the right illumination, and everything. And one thing that will also be pointed out in the next lectures is that the ergonomics, that you have more comfort. I mean, I just was in an interview talking also about 3D microscopy when we do cataract surgery, and this was a big topic that you have strain if you look into the microscope and stuff like this. And with the slit lamp, we actually do that every day for hours. We actually, I'm personally use more a slit lamp than I do surgery, and therefore I think with all these natural poster support, motorized adjustment, and so on, it is much more comfortable for us. And also, of course, for the patient who has a spacious headrest. Let's see a little overview now about the highlights of the Elara. Can you switch on the tone? So, wow, I think we should use that kind of music every time we look through a slit lamp when the patient comes to us. And I can say that even when the femtolaser was first introduced, we didn't have that fancy video. So congratulations actually to Haag-Streit. It really is inspiring actually, isn't it? Because you see you have something new and it's exciting. And I think the video very nicely points out a lot of the new features. Here you see on this photo one thing that directly pops into your mind when you see that, the way you can document things. I mean, in former times, we looked at the slit lamp, we saw some interesting thing or something we thought we need to document. Then the patient was told to go upstairs to the photography department. Then somebody did the photos and didn't really do the photograph of what you really wanted him to take. But you saw that later when the patient was gone. Now you can really directly look at the patient, do the photo or do a video. There is actually a dual camera setup that allows for optional 3D video and image capture in 4K. If you go to the Haag-Streit booth, you can see the 3D view, which I think it's very interesting also if you have an educational setup, or for example, if the patient's relatives or people are there and you want to show them something directly. This is very impressive also. And the thing is, if we think about patient comes to your practice, gets all fancy kind of diagnostic tools, and then at the end he comes to you as a highlight of the examination tour, and you are using a 40-year-old slit lamp, and you're manipulating it like this, and you're doing this. Going there and having this kind of fancy equipment really also tells the patient something about you and about the way you treat your patients, or you look at your at these things. One thing that is quite important, and I think Filomena will talk about that later on also, about the way you have a more ergonomic and fatigue-free working posture. We look at so many patients, and I run from one room to the other and look at the slit lamp, and I have to adapt to different heights and everything. And so for me, this is a very, very nice motorized height adjustment. Also, the way I look through the oculars is really very good here. We actually did a little evaluation because this is something so new. We asked our residents and some of the doctors to answer some questions on a survey here. And one thing was interesting. On the one hand, we could see that the length of the examination was slightly faster, especially when you had the preset examination routine in it. On the other hand, a lot of them then reported it took them longer because they were doing a lot of documentation, making photos. So on the one hand, you can go through the examination faster, but I think at least at the beginning, when you start to explore all the gadgets, you will almost make a video of all the patients that you have, which is not a bad thing, frankly speaking. On the scale to 5, we were asking them if it's very difficult or easy to adjust to the new slit lamp, and there we could see that the younger residents are much more attached to this kind of technology than the older faculties. That didn't see much of a difference. The adjustment period here is slightly better with the Elara, but I think this has contributed to our residents who like this kind of stuff more. Neck comfort and ergonomics was also asked. 70% of respondents voted for the Elara as more ergonomic. This is something we can understand. 30% voted as undecided, but 0 voted for the traditional slit lamp being very ergonomic. And then the image quality, more or less everybody voted for Elara is superior. We have a mixture actually from Haag-Streit and Zeiss slit lamps in our clinic, so they were comparing it with 2 types of slit lamps. Then also the fundus visualization, and especially for the resident who at the first couple of months is really fighting to recognize anything from the posterior side. They were very fond of it. 75% voted for the Elara as having the better fundus visualization. And the good thing is you can actually make a video when you do that. Something that is very difficult, of course, with the other slit lamps. So in the documentation options, and we only explore part of it because we didn't have the 3D image and eye captures here, but 100% of the respondents voted that they would implement that, and there is a direct connection possibility also to whatever system you have in your practice to transfer the data and the images or videos. So this will be also very interesting. There are some comments from the colleagues when they were, it's unfiltered. You see some are positive, some are negative when they looked at the camera at the beginning, and maybe these are the thoughts that come into your mind also when you go to the booth and look at it. And final choice, most of them would pick it. I don't know if they have the financial background, our residents, to pick it, but nevertheless, they were very interested in it. So this is what you find here. Just a few findings here. I don't want to go into detail. Oh, this is the wrong presentation here. This is not so nice. Okay, this was actually a camera inlay case. Wait a second, I can fix that maybe. Let me see how this is. Yeah, so here you see a camera inlay, a very bad situation. The inlay has opacified very much the cornea, as you can see. And with this you can actually do some little videos, as you can see here. Another case here with the CARES procedure, where you see here the implanted tissue inside the cornea. Here you see this being done. Or here we have an interesting case of an add-on lens where the toric add-on lens has decentered. And what we can do actually is measuring the axis very nicely, and then it will be displayed here 145 degrees, which is also quite nice when you look at your patients. So let's now go on and let's share the experience of our other speakers, and it's my pleasure to call in our president, Filomena Ribeiro, who will talk especially about the ergonomic design and how this matters for eye care providers. Okay.
Thank you so much for the introduction. Beautiful, beautiful videos that we saw, and yeah, it's great to have good technology. We all like technology, right? We like that our patients see well, but we like to see well our patients. But the truth is, how many of us, when try to acquire some new instruments, think about ergonomics? It's something that does not come to our mind, but it's very, very relevant. We need to work. Right now we have to produce a lot of consultations, and we need to watch for ergonomic designs. So, and why these matter? Look how many eye care professionals can report pain for using a non-ergonomic device. There is a risk, and this has truly an impact on our longevity career. We need to take care of this. And then another important matter is that this affects more women. Devices are not ergonomic designed for women. And right now we have more and more faculty as women. Something also to consider. And there is a lot of publications on this regard, so it's nothing that we are saying without the proper evidence. So the problem is really in a typical slit lamp, we need to flex our neck, we need to forward lean, and we have no support for our arms and the shoulder. they have recent this, and we have some strain. So we need to consider to go further on this development of the new designs of equipment being ergonomic. And there is this syndrome, the slit lamp slip, and this very challenging to overcome with the traditional slit lamp. So that's why I'm so interested on this optimization that we are seeing today. And this is nothing that the other associations, they are looking for this and making recommendations. If you see, the AAO is providing some guidelines for us to avoid this problem for the future. So it's something that really we need to consider to have better solutions in our equipment. We need to adjust very well the tables and the chairs. We need that the oculars being with an angle that is ergonomic for our head position. The chairs and the tables, they should have a better alignment. And this is all about prevention. So with good ergonomic designs, we can really reduce the risk factors for these problems. So that's why this new design is so interesting to me. Really makes better comfort for the patient, but also for the doctor. Has so intuitive controls that we can manage very well and in a fast way, so allowed us to see more patients. And this fatigue is something that at the end of the day, at the end of the week, we should avoid, and prevention is really the way to go. So, for sure, the next speakers will talk about all the solutions that this new way to go through the different models using the joystick allowed us to have more fast examinations without the need to adjust in any kind of observation that we are doing. So, it's easy for the patients, it's easy for us, allowed to be faster on our examination and avoid future problems. One feature that I really would like to highlight is the preset model. It really is amazing how we can preset everything that we do in our examination flow, and this really improve the time that we spend making adjustments that we need for seeing the cornea, and then the crystalline lens or the IOL, and then the fundus. So it's very easy to perform, and automatic needs less manual steps. So you can choose for every one the presets that you need, and that is customization, which is a way also that we need to go. There is already some scientific evidence about the use of this particular device, and we can see that in comparison with the conventional slit lamp, we can improve all of this. So having more comfort and this ability to adjust really is meaningful for us at the end of the day. Less fatigue with a very good working posture, we can reduce the strain, and that makes us able to be more free to spend time in the examination of our patients. We had the device in experience in our clinic, and of course it was a small time to do it, but at least we try to make also the survey to the users. We had 10 participants on this survey, 7 male, 3 female. I don't have statistics. This does not allow us to do statistics, of course, but I would like to show you that for all the questions, we only had 2 types of answers. And this is very meaningful, that we really are improving on the ergonomics with this design. So, as you can see, for the first question, this design affects your examination speed and workflow. The answers were only 2, strongly or somehow improved. The same for the space, for the patient and the position of the patient. Also, only 2 answers that we have obtained, significantly better. And if affects or not the posture, all the answers were significantly or somehow. They improve really our performance on our clinic. So, in summary, we need to consider ergonomics. It's fundamental for health and performance. These small adjustments, sometimes they mean really a big difference for us. The fact that we can have more ability to adjust and customize is really amazing, and is something that we need always to consider when we are achieving a new equipment. So now our clinics, they have multiple providers, and we need to consider a way to customize. This is something that I would like to share with you. We need to protect ourselves, we need to protect our practice in daily basis, we need to advocate for more ergonomic designs, instruments, and this is looking for our practice and for better outcomes for our patients. So thank you so much for your attention, and I hope you will enjoy the new features of this instrument. Thank you so much.
Thank you very much for your insights, and I'm now calling up the next speaker. It is Sunil Mamtora from Bristol Eye Hospital, and he will talk about Elara 900 versus BQ 900. And I have to say that he has a YouTube channel for slit lamps cases, and more than 300 cases he has displayed there, 5,000 followers, and it would be nice if you would also follow him, because I think it's very, very interesting what he is doing there, commenting on each patient journey that he is showing on his videos. So let's listen to his experience.
Thank you very much. Good afternoon, everyone, and thank you so much for joining our seminar today. I'm going to be talking about Elara 900, the refinement, and then the breakthrough. I'm an ophthalmologist. I work at the Bristol Eye Hospital in the UK. And just to start with, I'm going to give you a bit of a background about my perception towards the slit lamp. So, Dr. Auffarth, you mentioned that we use the slit lamp every single day for every single patient throughout our whole careers. And when it comes to the slit lamp, it's really an instrument that we completely neglect. Up until recently, almost all of the slit lamps in my hospital were manufactured in the 1970s, BM 900s, and we pushed so hard to get new slit lamps, and about 3 months ago, we took delivery of 25 brand new BQ 900 slit lamps. And this has caused serious problems in our hospital because everyone's fighting over the slit lamps. And so what I do is I come in early every day, and depending on which clinic room or which level I'm going to be working on, I actually move the slit lamp to my clinic room, which is my favorite one. And you might be able to see the picture in the slides there. I even put a sticker on the table saying, please do not remove this from this room. And so when I had the opportunity to use the Elara 900 slit lamp and I was told, well, there's new visualizations features, there's redesigning of the optics, I thought, well, the BQ 900 is the gold standard slit lamp. How can this new slit lamp be any better? And so when I used it for the first time, honestly, there was a wow moment. And I think it's really hard for me to stand on this stage and talk to you about this because it's something that you have to experience, you have to try for yourself. But when you focus on that corneal slit, the resolution, the dynamic range, the effect that you see there is quite astonishing. And so I've really enjoyed being able to talk to the R&D team and the colleagues at Haag-Streit to understand, well, how is it possible that we could design a new slit lamp which provides even better visualization than the standard, gold standard slit lamp that I'm already overjoyed with using? So there's a few things, and when you talk about it and you think about it, it makes sense. Conventional slit lamps shine a light from the illumination column and shine it onto what's almost certainly a dirty mirror. They then shine that onto the eye, and that's what you see. So with the new P-type projector illumination in the Elara 900, you shine that light directly onto the eye. You reduce that source of aberration, and unsurprisingly, you have a crisper image. There's also a new optical design, and you may be familiar with when you talk to your colleagues about using slit lamp camera systems, people often say, I like slit lamps and I like slit lamp cameras, but I don't want to use the IM910. I don't want to use the camera with the beam splitter because I have to extend my arm and that's just uncomfortable for the whole day. And I think what we were just talking about with men and women and different people's ergonomics, the Elara slit lamp reduces that need for extending. The optical system has been redesigned so the optical pathway isn't extended. And if you do struggle with having to stretch your arm further in a slit lamp with a beam splitter, that's no longer a problem. And so the most exciting thing that Dr. Auffarth was talking about is this P-type illumination, projector illumination. And this P-type illumination is completely different from what we're used to. It allows us to project individual pixels of light onto the eye. So if you really wanted to, in addition to a slit, a beam, you could even project pictures, icons, images, even movies. And it gives you complete control of the light that you're projecting onto the eye. And so with this, you can really leverage that ability to fine-tune and project each individual pixel. You can change the color temperature, you can change the white balance. And so in your presets, we all know that when we examine the cornea, we benefit from having that cooler color temperature. And when we examine the retina and the fundus, we benefit from having that warmer color temperature. So with the presets, we can leverage and link this ability with the projector illumination, and we can automatically, with just one slide of the projector illumination preset wheel, change from a cooler color temperature in our corneal slit illumination to a warmer color temperature in our fundus. And that makes examination enjoyable, more easier, and provides better clinical outcomes. And so just a bit of a technical background very, very briefly. The gold standard way of measuring the resolution and detail that an illumination is able to give us is this color rendering index. And this is really a laboratory way of measuring the contrast with which we can examine a subject compared to natural daylight. And what we can tell is that this digital light processing, which is leveraged in the Elara 900, provides that really superior level of contrast compared to both LED and halogen. And to really evaluate how this works in the real world, earlier this year at the Royal College of Ophthalmologists Congress, we did a small study with 20 ophthalmologists, and we asked them lots of questions about how they perceived the visualization quality between the Elara and the BQ. And the conclusions are here, and we're going to publish this in a white paper later on this year, but it was clear that 70% were clear that there was an improved visualization in the Elara, and 30% said there was no difference. So I've told you about the refinement, but now's the bit which you're probably a bit more excited to hear about, which to me is the breakthrough. And I'm going to start by asking you this question, is slit lamp imaging useful? We take photos of absolutely everything in our lives. Last night, many of you were at this president's dinner, and there's this WhatsApp group with colleagues who I went to this conference with, and it was full of lots of embarrassing photos and videos from yesterday evening, and I thought, gosh, that's great, but I wish you guys could take photos and videos at the slit lamp rather than all these embarrassing photos from last night. And it's so frustrating because I love taking photos and slit lamp videos, yeah. And Dr. Auffarth said I've got this YouTube channel, so a shameless plug that. Please subscribe to my YouTube channel. It's called Slit Lamp Studios. And it's really upsetting that this has such a huge clinical impact. In my hospital, the way we document our examinations is with pen and paper. We draw our findings, our squiggles. And when I look back at my colleagues' descriptions, sometimes it's genuinely difficult to understand, is my patient improving or not? And actually, I sometimes put more emphasis on whether the patient tells me they're getting better rather than even the diagrams. And the reason is there's no time. There's too much friction. We don't have time to load up a computer software, type in the patient details, link things, be frustrated with all these error messages. There's too much friction. And if we could capture our photos and videos at the slit lamp in the same way that we could capture our photos and videos and share them to Instagram, we can change the way we practice ophthalmology. And so I've been really proud to both conceive and develop this new functionality with Haag-Streit, and this is called connectivity. It's the ability to leverage the Elara platform, the screen, the software, to not just capture your images and videos on the slit lamp, but to take it to a new level. To capture those videos and photos, and within 10 seconds, send them directly to the electronic medical record, be it Epic, iSuite, CareFlow, Medisight, whichever DICOM worklist-enabled platform that you're using, you can leverage this system. And by using this, I really believe that we can enable that change in culture, that change in practice, which will have a massive impact on the way we practice and hopefully allow us to take those photos and videos for every single patient. And what are the benefits from this? First of all, we can capture all these photos and videos, and rather than relying on the squiggles in the notes and the patient to tell us that they feel better, we can so easily look at the photo and video captured from the previous consultation. It's so good for training because when our more junior colleagues take photos and videos and make their management decisions, we can understand why they've made those decisions and give them feedback. And most importantly, above all else, it allows us to be more confident in our clinical decision-making and improve patient care. So I'm really excited that this feature is going to be released as a software update for Elara coming at the middle of next year. So I hope you'll be able to experience Elara for yourselves at the booth, and I hope you'll agree that when we make it so easy for ourselves to take our photos and videos, we can change the way we practice and hopefully put more videos on the YouTube channel too. So thank you for your attention.
Yeah, thank you so much, and I really can recommend to go on his channel. So it's my pleasure now to introduce Dr. Maria Kugelberg from Karolinska Institute from Stockholm, Sweden, and she will talk on the real case scenario evolving my clinical practice with Elara 900.
Thank you, Professor Auffarth. I've had the pleasure to work with the Elara 900 for some months now, and I can just also say that I really enjoy it. It's like it's a revolution, really. Nothing has happened in this field since 1911 when Gullstrand invented the slit lamp. So it's been some years, but now it's here. And I have a private eye clinic in Stockholm, Sweden. So I think you have mentioned already, but the rest for the patients, some are a bit larger, and it has a feature that it actually goes out there, so they can have quite large chest and still be comfortable sitting there. And I'm also comfortable with the oculars here. And I think it's really great for the neck. You see, this is with the BQ. You kind of have this shape in your body, but when you sit with the Elara, you get a much better neck posture. And also you could really sit back. If you want to relax, you could also have it in the camera mode, and you can just, it's just a touch on this screen. It's a really nice touch screen here. And you can, instead you can watch the small screen to see what you're looking at. And then you can also show the patient either on the small screen or just take it up on the large computer screen. Closer. And this is really good for patient interaction, and you can also, I have a lot of both cataract patients and refractive patients, but the cataract patients often bring a daughter or a son, and they can, with the patient's permission, you can show them what actually is the problem, or if there was some complication, you can show what has happened and how you should fix it. So I think this really adds to the safety of the patient and the feeling for them. I think this is different, but I see this as a slight problem and a room for improvement. That the knob where you adjust the slit lamp. This is the slit height and the slit width. But when you move, you do that all the time. You move the slit lamp. This one moves too. So you unwillingly you change the slit width or height. But some like that. So it's. But I think that would be a room for improvement, to have a outer ring that you grab onto, and then you can move it. And if you want to change the slit width and height, you do that just by moving the step in. And I really like to take images and movies, and it's difficult when you have, like you said, Professor Auffarth, you have to send them to another room where the camera is, and then the patient has gone home, and you don't know what actually came out of that image. But here it's really easy. You see the image, and you watch the screen while you in the camera mode when you take it. So I have realized using this Elara that I often change the dominant eye. So I started, you put that in the computer which dominant eye you have, and I thought I was left dominant, but when I started taking images, I saw, well, I'm not. So then I often shift eye, but then it's much easier to just have it in the camera mode, look at the screen, and you see what you're capturing. So it's a really nice, because you see it directly. So I think it's a very nice camera mode. And it takes great images. This is of a subcapsular cataract, as you can see. And this is an image of a retinal detachment. You can see the wavy retina here, but here it's attached. And this is a kind of dense cataract with a really fibrotic posterior capsule, which you just have to leave during surgery and then YAG it after a while. So this is the fibrotic capsule 2 months after surgery, and this is right after YAG capsulotomy, taken 3 minutes apart. And you can also show this to the patient, that you had an uneventful surgery, but your capsule, it looks like this, so we have to fix it. And now it's fixed, so now it's clear again. And I really like the movie setting too. So this is the same patient with the fibrotic posterior capsule. And this is after YAG capsulotomy. You can see that it's much clearer here in the center. And this is the overview mode, and you can see all the details, and you can show the patient if they have nephritis or so. And this is the fundus view, and you easily switch between the overview, slit view, and fundus view just by scrolling this wheel. So you should go and try it. It's really nice features. And this is the PCO. You can see through the red reflex here, really alginate pearls and fibrotic capsule. And you can show where the cataract sits. This is both nuclear sclerosis and the posterior subcapsular cataract. And up in the north, where I am, it's really common with these exfoliations. And you can, while you're filming in the image mode, you can switch the enlargement, so you can project on whatever you want to. Now I want to project on the exfoliations, so you see it's really nice resolution. And this is a retinal detachment in a patient the other day. And you can show the patient that it shouldn't look like this. You know, your retina is all detached. But here it's attached. And this is a slight room for improvement too, which is coming in the next upgrade. So this, I am an old-fashioned toric marker, so I do it in the slit lamp. And this patient had, like, maybe should have 2 degrees, but it only goes in 5-degree steps. So you kind of have to figure out where is 2 degrees. So if you easily scroll, you see here the slit axis, you scroll it with this wheel, and it goes in 5-degree steps. But I heard that that's going to be fixed in the next generation. And this is a really nice movie of, well, I think most of you probably see what it is. So this is the slit view and the fundus view, and you can see the kind of mirroring of the retina here. So this is a gas bubble, yeah. So this is just a picture of the Elara. You sit quite tight compared to, which is nice for your shoulders. You don't have to have your arm over the shoulder all the time. You have everything gathered where you sit, and you just have to raise your arm for the fundus view. So it's really a totally different approach to examining your patients. So you have the really nice ergonomic oculars, and you have everything. Kind of gathered in the middle where you sit. And you have this very nice kind of slope for where the big patients, they fit. You don't have to like push them like you do with a normal microscope. You can often push the microscope into their chest, which doesn't feel so nice to them. So I'm very fond of this new invention, the reinvented slit lamp. Thank you.
Thank you very much. And I will now call the last speaker, Dr. David Goldblum from Pallas Kliniken, talking on imaging that educates. Before he will start, we will answer 2 questions that were sent to us. One was if there is no Goldmann applanation possible. This is not true. There is Goldmann applanation possible. You use the Goldmann R type for this. And then there was another question, maybe you can answer that, Dr. Sunil. How does the intern, the doctor in training, looks together with us to the patient only on the camera display?
Yeah, so there's functionality to be able to wirelessly stream the video to a separate screen.
Okay, Dr. Goldblum.
Okay, thank you very much for the nice introduction. Thank you very much for having me here. These are my disclosures. I just wanted to remind you that what sort of device is the slit lamp? We've heard it before that the slit lamp actually has many functionalities. We use it for examination, we use it for diagnostics, we use it for the documentation, for the imaging, and we use it sometimes even for surgery. You see here me on the Elara actually taking away a stitch, but I have seen anterior chamber tabs being done on slit lamps. So it is actually also sometimes a microscopic for surgery. And I have the pleasure as well to show you some nice images. The quality of that instrument is unsurpassed. Here you actually see that is DMAC, where you can actually see the border, the rim of the DMAC fully attached. You actually see also the old recipient endothelium on a DSAC, which has been operated on the same day. You see the fully attached DSAC lenticle, and you see the old recipient bed of the endothelium. So this actually is really a nice instrument. And as we've heard, an image, a picture, tells you more than 1,000 words. And this is an Iridia patient of mine. She has the latest Boston keratopathy. This is the Lucia. You see the loose stitches. But even better than an image is actually a movie. And that's what the patient really looks like when you examine her. There's this classical nystagmus in these aniridia patients. And as you can tell by the image before, when she's moving and she can't stop, she can't fixate, you can actually take crystal clear images even during these movements. What's even better is that you can take fundus images while having these movements. And that's really the beauty of this instrument. It has an image quality, and you see it directly. We've heard it. You take the movie. This is not a still frame from the movie, but this is actually a picture being taken. I don't use it while looking down on the screen, but I actually take the pictures and look later on if I'm happy with the pictures. So that's the way I use it. But everybody can actually adapt it to what her or his needs are. And as you can see, my loop is dusty and dirty. That's the disadvantage of having such a good quality, which will show you immediately what you're using. Coming to the topic of this presentation is actually, why is it important to share pictures with your patients? And there's something which is called in psychology the picture superiority effect, or why we all use images and pictograms in our slides. We know this from studies and from everything during university, that actually visualization of something which we hear or which we read is much better to retain than when you actually only hear it or only read it. This cognitive process by actually how visual is better stored than hearing or reading is disputed. We don't know actually where it comes from, but we are seeing animals, and that's probably where it comes from. So showing and sharing pictures is something which is really helpful, and I'll show you why. I had this patient who was referred to me with the question of his PAM, and actually was reluctant to have it biopsied or even taken out. And I showed him these images. These are, you can tell, these are Elara images. We've heard about the light source. We don't have this classical drop-like image reflection anymore. So if anybody shows you a presentation, says this is Elara, and you see something like this is an inlet here of an old, that's not the actual picture, but that's the reflection. So this is what we've heard is really new. You don't have any dirty mirrors anymore. It's a direct light illumination. And obviously when I showed these pictures to the patient, he was absolutely keen on having a biopsy taken. Unfortunately, yes, we were right. This was a melanoma, and he's in treatment now. But actually, this helped us a lot to treat and guide this patient. This is not only in ophthalmology. We have many studies in medicine where this has been proven. There is a meta-analysis of 42 RCTs where patients have been shown pictures, pictograms, or photos, images. And what they found out in this meta-analysis, that the pictorial interventions, showing the images, pictures, actually increased the understanding and the knowledge of the patient. It even made it better to recall the memory of what has been told to the patient has been proven to be better. One disadvantage, or not, it's not that advantages, is to have the patient increase of his adherence to treatment. So it doesn't help if you have a glaucoma patient and show him nice pictures or her nice pictures about the glaucoma and tell him you have to take these drops once a day or whatever. We know all the compliance. In that report, pictures are not helpful so far, what we know. There's also this other story that when taking pictures, the patients actually like it, but they don't like it when you take it on your private cell phone. So what you see on the right is actually an image-patient relation that the doctor is taking her private iPhone and taking images. And this, again, meta-analysis of the German Dermatological Society have shown that patients actually like it when you take pictures. They know that you can better compare your images than scribbling them down in notes and nobody can read them and doesn't understand them. But they don't like it too much when you take it on privately devices. But if you have it, like we've heard, on an iSuite or on an EMR, where it is stored in your hospital, then they actually like it, and that's something which is well liked. You're going to ask me, are we having any studies in ophthalmology? And it's unfortunately not really anything I've found. I've found one little study which has been published in the ESCRS regarding what patients can retain after cataract surgery. There were 3 groups, and I should quickly show you. The standard group, the hospital did cataract surgery in them and didn't tell them anything. They left them going home. The other group was getting a written instruction. The third group was getting these nice images. And unsurprisingly, 64% of these patients who didn't get any information, they avoided much more, and they were much more wary in their postoperative care for themselves, which might not be bad, than the other group. In the photo group, there was only unnecessary avoidance in 30% of the patients. Our clinics belong to the second group. We give it something written, but I thought about, when I made these presentations, maybe we should add some nice pictures on this that will be maybe increasing the help of our post-cataract patients. So we also did a study. I think we all were asked when we got the machine to do some little studies. It's again, as Filomena said, not something very scientific. We asked all our staff, doctors, residents, and optometrists to actually use the Elara. And when the patient checked out, the technician was handing out, so it was direct the doctor, but the technician handing out a paper to fill out up between 1 and 10 on a scale of 1 to 10. How comfortable were you with your examination? And unsurprisingly, the Elara and the BQ were as comfortable or as uncomfortable as the other one. What really pleased me, because there was no difference when we used the Elara versus the BQ, that how good the patients were informed was actually the same, which is thanks also due to the colleagues, and they really treat our patients very well, and I think that's really thanks to them. What we looked as well at is that how much chair time we use on these patients, and we found out that obviously using the Elara is taking a little bit longer because you take the pictures, we've heard this before, but you also have to show them and explain them. That takes about a minute more of your time or of the patient's time, which I think, when we look back at what we've heard, that the patient actually understands much better what you're doing, what we are doing, then this is well invested time. And it might change. Even these were new users on the Elara, so this might be even faster. So taking home, concluding, is that I hope I could show you that sharing photographs with our patients will enhance their understanding. It will enhance their confidence in you, in us. It helps, we've heard, the disease tracking, because you have consecutive images, movies, where you can actually really compare what you've seen or what has been seen by somebody else. And as we know, in general, pictures are really more effective than words or text alone in retaining something and understanding it. And as we all said, we really should go and subscribe to the Slit Lamp Studios. Sunil, we make a lot of advertisement for you, but I really think that is the way to go, and I hope there will be a lot of new videos coming from the Elara on your channel, and I know from Haag-Streit as well that there's much more coming on that platform of the Elara, which has advantages which will be coming further on in the next months, and I really look forward to see you next year when we can talk about that. Thank you very much.
Yeah, thank you very much. We exactly hit the time. The symposium is over now, and I think you've learned quite a bit about the new Arte Elara. And as we said, every image is better than whatever we say. So go to the booth, to Haag-Streit, have a look yourself to the new camera and the features there. I think you will be amazed. Thank you very much, and thank you to all the speakers.